Chow and I are both respiratory therapists. He works in a hospital. I do more home health. Healthcare professionals. We help diagnose, treat, and educate patients, all having to do with the cardiopulmonary system. We can work in hospitals, emergency rooms, clinics, home care, education, private enterprises, and research facilities. Did the strollers happen? Just one? And then we're missing the top piece.
Same PowerPoint. Same smart computers.
Oh no, that was the right slide. Just the top part across that. Oh, look, there you go, child. Little arrows.
All right.
One more.
Yeah.
Touch it one more. All right. How we assess and diagnose, we can do testing like pulmonary function testing, do blood gases, we do only stick arteries for arterial blood gases, sleep studies to see if people stop breathing in their sleep, have obstructive sleep apnea. We don't actually do the chest x-rays ourselves, but we do view them, see how the lungs are doing, see if they're intubated, if the tube's in the right location, listening to the lungs, stethoscope. Treatment, different things, it depends on what setting. If they're just in the hospital, say for asthma, if they're having an asthma attack, we'll give them medications, do different breathing treatments. If they're really bad off, can't breathe on their own, they may be on a mechanical ventilator. We have to maintain the airway. Sometimes they are intubated, so they may have a tube down their throat, or they may have a trach, or sometimes they just need a mask and just oxygen. Their airway is okay. It may be a good fit for you if you do well and understand the general sciences. You're able to interact well with others. You can deal with sick patients. You enjoy technical types of things, and you're not afraid of a fast pace. I would say the hospital is definitely more fast-paced, and you would be a lot busier than home health is for the most part.
Yes.
And we'll discuss the differences on what we each do. You can go 2 years for an associate's degree or 4 years for a bachelor's. The pay is typically the same. You can be certified and get registered with either, but bachelor's gives you more opportunities, like if you wanted to teach or do any kind of medical sales, that would be the benefits of that.
Oh, you could be become a manager. You know.
Yes.
So.
More opportunity to move up and do some different things. Typical day, you could be giving aerosol treatments, assessing patients, educating them on different therapies and how to prevent asthma attacks, for example. Managing mechanical ventilators if you're in the intensive care unit. CPR, diagnostic testing, and sometimes you run with doctors and others to develop care plans on your patients. These are some good and bad things about the job. You're being part of helping someone to get better. Most of your patients are going to be sick. You're not dealing with the healthy patients. You're making a difference. Furthering patient care and science. I mean, it's something you, if you're in the hospital, would be doing 24/7, or you have the opportunity to do it. Hospitals are open all day and night, so it just depends. And sometimes, yeah, you're in stressful situations. Somebody may be coding, and you may have to perform CPR, and you're actually saving somebody's life, and it can be overwhelming, but it's rewarding at the same time. RT makes, new grads typically start around $20 an hour. It kind of depends where you live. Maybe a little higher, maybe a little lower, and that equates to about $41,600 a year. After a few years experience, 27, which equates to $56,160. At hospitals, they typically have differentials. So if you're working the evening or night shift, you're going to make a couple more dollars an hour, as well as holidays and weekends. That's typically even more. I have like a set hourly pay, but I also get mileage reimbursement. So it all kind of varies.
Yeah, Louisiana is the lowest pay from any state. You know, California, Texas, they pay pretty good.
Yeah.
So if you wanna travel, you wanna go out of state, then
yeah,
that's your
you
thing.
can research the average incomes in different states, depending, you know, if you plan on moving somewhere else. So just the biggest diseases we picked. COPD, chronic obstructive pulmonary disease, is the fourth leading cause of death. It's mainly caused by cigarette smoking or being around it often. It can be diagnosed early and treated early. It can't be cured though, so the best preventative is not to smoke, and it is made up of chronic bronchitis and emphysema, and some may have asthma as well. And then your second is asthma. That's the most common chronic disease in childhood. There's 22 million asthmatics. Increasing frequency. It can be managed with proper medication and education. Those are definitely the most important things to do. Some children will outgrow it. Some will keep
Some
it for
never
life.
will.
Yeah. So it just depends. And then I just added on what I was going to be showing them. I think we only have one more. So me, I do durable medical equipment. It's like home health, but we don't do ventilators in home. So I actually go into people's homes and set up BiPAP or CPAP machines. A BiPAP is bi-level, so it's two different pressures of it's positive airway pressure. So whenever they inhale, they get a higher pressure. Exhale, they get a lower. And it's to keep their airway open, because typically it's people having obstructive sleep apnea, so they stop breathing in their sleep when their airway closes. Sometimes it's people with COPD who just can't get enough air in and out, and it helps them to breathe better. And CPAP is just a continuous positive airway pressure, one pressure. That's what I put out most often. So I go to people's homes and teach them how to use and clean these machines. I brought one in. So I would typically show them the setup. There's the humidifier that they would add water to, just to help give them humidity to their airway so it's not dry and irritated. I would teach them how to properly assemble. There's one button to turn it on. I would fit them with a mask, which they have different types. They have a full face, is what we would call this. It covers the nose and the mouth. Then they also have one that just covers the nose, and then they have nasal pillows that go into the nose. So I would fit them with that, help them adjust, see which works best for them, and then I'd go over cleaning. And then it's about resupplying. They can get new supplies every so often. So I am more on that side. I go into their homes and do that, and sometimes it's comfortable situations. Sometimes people don't look the cleanest, and it's not the most pleasant, but it's rewarding. I'm definitely helping a lot of people with their sleep apnea primarily, and I enjoy that. I enjoy having that freedom. I'm out on the road and able to schedule my own patients. Chow works in the hospital, and he'll tell you kind of how his normal day would go.
Most of the time it's just breathing treatment, you know, like asthma, you know, COPD, you know, they come in, they can't breathe, you know, their reasons, so we just give them medication to open up their lungs and stuff. But sometimes, you know, worst case scenario where people come in and they have a heart attack, so we have to put a tube down their throat to, you know, to breathe for them with the machine, with the ventilators. Or you're at home watching TV and then you're like, I'm hungry, so you go and get a peanut butter and jelly, and you didn't know you're allergic to that, so your tongue swell up and you stop breathing. So you put a tube down and then, you know, help you breathe too, you know, until your tongue, you know, subside, you know. So that's basically it, you know. But sometimes it's very stressful, you know, because sometimes it's like we have, you know, coat here and there and there, and then, we have to do, everything to save the patient. But it's all about saving the patient, So not really. It pays okay, but if you like, working with the patients and you walk around and you talk to them and you help them, breathe, so that's something that you like to do. So
How many patients do you say that you see a day?
we see the whole hospital.
The whole hospital,
Yes.
whereas yours, how many do you see?
Okay,
roughly?
so it depends on what I'm doing. Like yesterday, I only needed to get supplies to patients, so sometimes I'll deliver it, sometimes I will just ship it. Yesterday, saw no patients, still get paid, 8 hours that day. I sent my supplies, so nothing. Then say tomorrow, I'll have a setup or two, and then I have to do supplies. I get to make my own schedule, so some days I have no patients, still get paid full time, and have benefits. Some days I may have a couple patients, and I have my own area. I cover the West Bank, New Orleans, St. Bernard, as well as across the lake, like Covington, Mandeville, Pearl River. So I have a big area. But where I am, we don't have too many patients coming over. There's only 2 therapists at my work. And so I may have a setup in Bogalusa, which is a 3-hour drive there. That's one way. So I'm driving at least 6 hours, plus if I'm setting somebody up, it's typically 30 to 45 minutes. But lately, they're primarily closer. So say I have to go to Marrero, do a setup for 45 minutes, and then I'm done. I calculate my mileage, and that's my day. So I have a very open and flexible schedule, which is you're in 5 days a week. Monday through Friday, so I have weekends, holidays off, as opposed to the hospital.
It's open 24/7.
Right.
Yes.
And do you shift?
Yeah,
Shift work?
I work on 3 days and then 4 days. So basically, I work every other weekend. Yeah.
And like in the hospital, I worked at university for a couple months, and like in one day, I had 26 patients. That's
Nuts.
a large load. Some of them were only checking their oxygenation. I'd have to go and just do a pulse ox. But then some were breathing treatments. And at bigger, busier hospitals, I feel you can't give the proper patient care. It's more about charting, documenting, getting the work done within a certain amount of time, as opposed to like a smaller hospital, like he works at Oshner. It's not as busy. They're not having all these gunshots. Just, I guess it's not, yeah.
It's not one-on-one.
It's
So-
less trauma.
Yeah.
And right, so he probably wouldn't have 26 patients on a shift. So I think that would be better to start off with, whereas right out of school, I went straight to university and home health, and it was 2 totally different things. So of course I stuck with home health. But I think it'd be, more common. Some days, if you're in ICU, you may just have 4 ventilators to manage. You have to check those every 2 hours. Check all the settings, see if there's any new orders to adjust. And then within some of those, you may have to give treatments while they're on the ventilator, in line. And you're suctioning, and sometimes you have trach care. There's a lot more to it. And then you may have some patients not on ventilators, but they try to still keep you in ICU in that same area, because if something goes on with your patient and they're coding or something's going down, you need to be available to them on your shift.
Yeah, you need to be close by. When they call, you have to be right there instantly. Because if not, then it's not good.
Yeah, and then you're in big trouble.
Yeah.
I mean, generally, right, they have other therapists on the floor. You have a couple in that area, but
Right.
yeah, definitely big differences. He's definitely going to be busy and actually working the whole time on his shifts, and I am not, I guess.
So you would say yours is more like if you like to see different things throughout your day and not have that consistent schedule, it would be better off to be in the hospital
Right.
versus in home health where you have a lot more leeway.
Right, so it's great for me. I have a family.
Right.
So that's great, 9 to 5, which I, like, since I schedule my own, I definitely don't schedule past the time my daughter's off of school. However, there is a chance that I could get that call, somebody's getting discharged from the hospital, and if it's before 5, I'm still gonna have to make that drive to wherever it is, get them set up before they leave the hospital. They like them to be set up and know that they're going home with the equipment they need, so they're not responsible